People are back home, back to work after the long holiday weekend. We know some did travel to see extended family, so what should happen now? Joining us is Dr. Brian Hollenbeck, Chief of Infectious Disease at New England Baptist Hospital. Good to see you.
Good to see you too.
All right, so what should a person do right now if they expanded their bubble for the holidays? Maybe worse, they learned they were exposed to COVID-19.
Well, if you're coming back from a state that's on the travel advisory, then it's a good idea to get tested per the Mass state guidelines. In addition, if you've been with other people over the Thanksgiving holiday, you should stay in good communication with them and make sure that you know and that you share if you develop symptoms, so that if anybody does get symptoms within that group, they seek testing, and if there is an exposure, everybody gets tested in that scenario.
All right, communication, so important. Let's talk about vaccines. Moderna is asking the FDA for emergency use authorization of its vaccine. Its trial showing it's 94% effective. What does that mean exactly, and how does that compare to the other vaccines?
Well, it's really good news. In these studies, they looked at about 30,000 people. 15,000 get the vaccine, and the other 15,000 get a placebo, something that's not the vaccine. And they look at how many people get COVID in both groups, and they found that only about 5% of the people compared to the non-vaccine group got COVID. So there was, I think, 185 cases of COVID in the placebo group and only 11 in the people that had gotten the vaccine. So it was very effective in preventing the virus. It's also very comparable to the Pfizer study, which is great news. So we have two studies, two similar vaccines, and very consistent results.
So let's just dig into that for a second. The studies are they're a little bit different, making sure we're talking about keeping you from getting sick. Is there other information, though, that we don't know about yet when it comes to the efficacy or immunity?
Yeah, there is. There's a lot of important information that we don't yet know about what vaccination means. We don't know how long the immunity will last for. In these studies, they're looking a couple months out, but what will it look like a year after you've been vaccinated? We don't yet know what that will look like. In addition, we want to believe that getting the vaccination will mean that you're not contagious, that if you come in contact with the virus a few months down the road, that you won't have a low level of virus and spread it. But we don't yet know that, so we still need to learn that information.
All right, Dr. Hollenbeck, thank you so much for your insight. As always, we really appreciate it. Thank you.